This program contains adult content.
Is there a God?
Big atheist.
Really?
What am I, an idiot? Come on.
That yes, it would be nice if you could throw your sins and your responsibilities on someone else. But it's not true.
It looks like far-left lunacy.
I don't believe that it's true that religion is moral or ethical.
You don't need to follow anybody!
It's not human intelligence!
If someone doesn't value logical consistency, what logical argument are you going to give them that will demonstrate that they should?
Hello and welcome to the Godless Revolution. Today is Wednesday, March 23rd. This is episode 373. My name is Dan Ellis. I'm joined by two awesome co-hosts, Mr. Ryan Duffy.
That's this one.
And Mr. Taylor Grin.
Yeah, this is that one.
How are you fine sirs doing on this Wednesday eve?
Weather's getting nice.
Yeah.
I kind of wish it would stay like it is right now.
Well, I wouldn't want it to stay like it is right now. Like, it's nice and sunny, but it's also, there's a nip in the air. It's a little chilly.
Yeah. It's 60 degrees.
Yeah.
Perfect.
Perfect if you like to wear long pants and long sleeve shirts and maybe a jacket all the time.
I was working in the garage today, short sleeve shirt.
Uh-huh.
Yeah, I like to work and not sweat.
Yeah. Well, then how do you know that you're working? Like, that's a sign that you're working is if you're sweating.
Oh, the project gets done.
I guess that's another really good sign, too. That's probably a better sign.
It's like, fuck, man, I only got one nail in this thing, but I'm sweating.
I must be working really hard on this one nail.
Oh, man.
The project gets done. Oh. Fuck you, Ryan. That was an excellent answer. Also, happy birthday.
Thanks,
Mr. Duffy. How old are you now?
38. Another trip around the sun.
Wow. You're much younger than I am.
Well, so are you an elder millennial or a Gen Xer?
I'm an elder millennial, or I'm not a millennial and I'm not a Gen Xer. Depending on
Xennial or whatever they call it.
Yeah, there's that middle phase where it's like, for the beginning of my adolescence, didn't have internet. That wasn't an available thing. And it wasn't until like middle school for me where internet was becoming more of a thing. And we didn't have cell phones. Like, I had one of those little like cheap, buy a phone card thingy and put minutes on this thing to make a phone call with to say, hey, the cops are coming to that house. Fucking get the fuck out. But that was about it. So I do kind of land in that in-between phase.
Did you have a beeper?
Actually, I did.
A pager, yeah.
In the military. When I first joined the military, I had a beeper that was for callbacks.
Nice.
Oh.
So.
Awesome. Very cool. What's new with you?
Not much. Just, doing my woodworking still. Yeah, which is a funny story because I started on this dog urn today, and I sent him he sent me the photo, and I said, yeah, here's kind of like I did my stuff with the photo. Like, here's kind of like what the photo will look like when it's burned on the wood. I said, well, then I just need the words or whatever you want put on there. He's like, wow, he's still around. And I was like, oh, okay. Whoa. He's a really old dog. And they're like, we wanted to get an urn made for him. But I'm like, I just don't have the rest of the dates for you.
Just want it on the
rest. Okay. It's like, okay. And I'm like, no problem. When the time comes and you need it, I can have it. I can have it here and ready, and I can finish doing the wood burn into the top of it and then get it to you when the time is appropriate. But I thought I was making this for him, and his dog had just passed. It's like, no, the dog it's getting to be the time when it's either dog's not going to wake up in the morning or we're going to have to make the decision to go to the vet soon. And
poor boy.
And that's always tough.
Yeah.
Yeah.
I know it was really hard.
I don't believe in a heaven for humans, but there's definitely one for dogs, and all of them go to it. So.
Yeah, I know it was really hard when I had to do that for Luke. And I wish that I had done it a week before, because by the time I did it, it was past time, and he was miserable and suffering for the last few days. And I still feel bad about that, but it was like, it happened really quickly. But
that's what I had a buddy a couple weeks ago. They had made the decision, hey, when I get off work, we're going to have to put her down. Like it's that time.
Mm-hmm.
And the day before he went home, his wife called and said, hey, she's really bad right now. We need to get to the vet. Like, we just need to do it today.
Mm-hmm.
And she died on the way into the vet.
Oh, wow.
In his arms in the back of the car. So he's like, yeah, it sucked. And then they held the dog's ashes basically fucking hostage.
What? How? Why?
He's like, well, he went and had it done. And he's like, how much did it cost for me to get the ashes back? And they're like, or what, like, what's the cost? He's like, they're like, well, it's $160 for us to bury him. He's like, well, where do you bury him? Like, well, we just dump the body in a dump. He's like, what?
You're going to charge me for that? Like,
yeah. And he's like, well, how much to get the ashes or get her cremated? $400. He's like, I don't want you dumping her body in the dump. So I guess we'll do that. And he's like, $400 fucking dollars. He's like, it was only $80 to put her. It was only going to cost $80 to put her down. And then it's $400 to get her ashes back.
Wow.
They're like, we're either you can drop her off. Like, she's either going to the dump or we'll cremate her, depending whatever, but you got to pay us $400 to get her ashes.
Yeah. Well, and I know, like,
your own pyre at that point.
Yeah. Well, and sometimes the 400, that sounds excessive, but sometimes, like, I know when we had the vet come and take Luke away, it was, if I wanted his ashes back, there were two different options. One of them was, that we'll cremate your dog along with several other dogs. And so it'll be a mix.
Don't know who you're getting back.
Yeah. Or it can be, that you can pay extra and we'll do them separately. And
okay.
So maybe that's why the 400 was the number that he gave, but
yeah, no, I'm having my own pyre for avocado 50 years from now.
Yeah.
That's
50 years from now for sure. Yeah.
It sounded like that vet office was just complete dicks. He's like, especially like they could have lied to me and said we have a pet cemetery back there for $160. Mm-hmm. And I would have fucking believed it. But no, they said we're going to dump your dog in the city dump.
Yeah, that's fucked up.
Yeah, that's kind of
super fucked up.
Yeah. Wow. Well, that sucks.
Yeah.
Well, I'm glad that you're preparing the urn for the eventual demise of their dog. That will be a wonderful keepsake for them, I'm sure.
Oh yeah.
Yeah. Well, what's new with? Go ahead.
I get more requests for urns lately than I do for humidors. So, but I mean, one holds ashes and one makes ashes.
It leads to ashes. Yeah. What's new with you, Mr. Taylor?
Oh man, a whole bunch of stuff, none of which I can quite talk about yet, though in a few weeks, hopefully, when, I can talk about it, you'll look back on this episode and be like, oh, cool, that's what that was about.
Mm.
Want to give a big ol' fucking thanks to Ryan. Thank you so much for making that cane for me. I'm really looking forward to getting it tomorrow, especially on such short notice and basically going with my weird ass design specs. So thank you so much, man.
Well, I mean, I even tested it out myself and I sat down. I'm like, yep, I can grab shoes with this. I can grab a door with it. And then I added some leather onto it too, because I felt it had to have a little bit of different aspect to it.
Yeah, no, it's got some panache. So I'm looking forward to that. I simultaneously hope that I don't have to use it all that much, but I'm super excited to. So
to tell you the truth, I walked around the house with it quite a bit, being like, this is kind of fun.
Yeah.
Canes are a thing I might want to do.
Yep. Yeah. Well, good, because if this issue persists, then I'll probably want to have options. So.
Well,
Yeah.
and Ryan has the mustache. I mean, all you really need is the cane and the monocle.
I know.
Turn into Mr. Monopoly.
Here we go. I just need the money too.
Mm-hmm.
Great.
Or I can pretend.
Oh, fun. Well, I have just been super busy with work, of course, still, always. And it's not getting better. Eventually it will be. And I know there are things happening that will eventually lead to a decrease in my workload. It's just not happening nearly as quickly as I had hoped. And so Taylor, you tried calling me on Monday, and I responded several hours later saying, "Hey, I saw that you tried calling. What's up?" But what I have not mentioned to either of you, like even before we tried calling or anything, was that I didn't answer because I was in the emergency room.
Oh no!
Yeah. So Sunday, I got up, was doing my normal, gonna watch my news programs, making coffee, getting everything ready in the morning, and I was just sitting at the kitchen bar area, enjoying my coffee, watching one of my Sunday news programs, and out of nowhere, my heart just started pounding out of my chest, like beating really, really hard, and then it would like stop and it would flutter, and it like there was some chest pain, and I was like, well, this isn't good. I'm an overweight man in his, late 40s. This
having ventricular defibrillation,
and I've I used to smoke a lot. I used to drink a ton. I'm not in the best of shape. I've been working out, and I've been going on walks and doing my golf and lifting weights and all of that, and I've been feeling a lot better, but I am still, not in very good shape. And I have my smartwatch, and I thought, well, I'm just going to do my ECG thing on my smartwatch here, and I'm sure it will be fine because it's always been fine. My heart every now and then, I think probably everybody has had this experience, and if I'm up in the night, you guys can let me know.
Where it feels like it skips a beat.
Yeah, where it skips a beat, or it'll pulse really hard for a little while, and then it settles down, and you're like, what the fuck was that all about, Mr. Hart? And it's like, fuck you, I'm just doing my thing. But so that's happened in the past, no big deal. But this one, it was weird. Like it just lasted a lot longer, and there was some chest pain involved, and then my arm started tingling a little bit, my left arm, and I was like, these are all things that like I've seen on television and in movies. People say that's bad when that happens, and
that's a sign.
Yeah, this is something you should have checked out. So I broke out my watch. I did the ECG thing, and it said that it detected atrial fibrillation, and it has never said that before. And so then I got a little freaked out. So then I did it again, and it said the same thing. And then I did it again, and it said it was fine. And I did it again, and it said it was fine. And so I wasn't sure what to think. But it said that you should talk to your doctor about this as soon as possible, and you can save the results and print them out, share them around, whatever. So I just thought, okay, well, that was weird. And then I didn't feel right the rest of the day, and like finally, it lasted for, I don't know, maybe 5 or 10 minutes, and then settled down, and I felt okay, but still like off all day long. And so Monday, go ahead.
Let's say, did you feel like a little lethargic? Just
not really lethargic. Just, I don't know. It was, I don't know, like
on the verge of fainting.
Yeah, I felt a little lightheaded, maybe a little bit dizzy. Just not right. Like something was off. And, so I went to bed, got up Monday, started doing my work day. And then I remembered, well, not that I remembered, but I, did enough work stuff early in the morning that I figured, okay, well, now is a good break time. I'm going to take a break. I'm going to call the doctor to set up an appointment, whatever. So I just went into my chart online to schedule an appointment. And when I logged into my chart, it said that that I'm due for a colorectal cancer screening. And I was like, great.
So you're like, nope.
Colonoscopy. Well, I might as well just schedule that while I'm on here. So I selected that, and then, that I needed to set up an appointment for something. So then it starts asking you questions that you need to answer as a pre-screening for your colonoscopy. And one of them was, have you had any heart problems recently? And of course I had to answer, well, I'm not sure. Like there was something that happened yesterday, but I wasn't sure what it was. So I said yes. And then it said, well, then you need to speak to the doctor before so that we can schedule or see what's going on. So then I had to call the doctor. I called and spoke to somebody in the nurses or scheduling or whatever. They asked what I was calling for. I explained what happened. They said, okay, well, I need to send you to somebody else to do triage and figure out what we need to do with you. So they sent me to somebody else. They asked me a series of questions. And at the end of the series of questions, actually the last question that she asked was, this is going to be weird and it may sound like it's kind of coming out of the blue or anything, but have you done any cocaine recently? And I was just like, no, actually I've never done cocaine because I was always worried that I might like it too much. So it's one of those things that I have just always avoided. So no, I've never done that. And she kind of chuckled a little bit and she said, oh, okay, well, that's fine. She said, but, with, all of the answers that you've given me and the symptoms that you had yesterday, I'm going to recommend that you go to the ER, like now. And I was like now? Like, can I wait till the end of my schedule or whatever? She's like, well, that's, it's ultimately up to you, but my recommendation is that you go as soon as possible. So yes, if you can, you should go right now. And
you should have went yesterday.
And you should, yeah, basically.
Yeah. Do you mind if I jump in here real quick?
Sure. Yeah.
Just for listeners, I'm not a doctor. This isn't medical advice, but if you ever think that you might be having a heart attack, every minute counts. And there are people who have died of heart attacks, the next day, because it wasn't a big heart attack. It was a little one, but because the tissue was allowed to necrotize for a few days, it took him out. So don't do what Dan did. Go to the ER immediately. I'm sorry to interrupt.
Oh no, I think
I've been having a minor panic attack over here hearing you tell this story.
No, that's good. That's a good public service announcement. Don't do what Dan did.
The whole talk about don't man up and just get through your workday. If you need to go, you got to go.
Yeah, well, but I mean, so Monday I felt okay. She asked how I was feeling. I said, I still feel a little off. I don't feel 100%. I feel pretty good, but there's a very mild chest pain. She asked if I felt confused, if I felt dizzy at all, and I said no more confused than I always feel. And I don't feel dizzy. I'm a little short of breath, but that's that doesn't it's not hugely concerning to me. And I feel okay. I'm calling because the thing said that I should call because I didn't know what to do. And so she said, yeah, you should absolutely go to the emergency room, immediately, and you should have somebody drive you. And of course, Tracy wasn't even out of bed yet. She sleeps in fairly late and doesn't start her work day until later in the morning, almost creeping into the noontime sometimes.
I'll leave it at that.
Yeah. So I just sent her a text and said, hey, are you up yet? Because I didn't want to go in and wake her up. And, she responded yes. And I said, well, the doctor, the triage person that I called says that I need to go to the emergency room and that I should have somebody drive me. So then, of course, she comes storming out of the bedroom and into my office. She's like, what's going on? Are you okay? What's happening? So, anyway, we get the dogs situated in the morning. I throw on some pants, send an email to my boss and say, hey, I've got a medical emergency. I'm going into the emergency room. So we get there. Tracy just drops me off because she needed to come back and handle other stuff. We have one of her mom's puppies here also because, she's got the litter mates. She had the male dog, fixed and had his nares fixed. And then I want to say Monday, she took her dog in, the female dog in to get spayed. And when the two dogs are together, because they're puppies and litter mates, they just are constantly playing and jumping around and everything. And she wanted to separate them in order to give the female some time to heal after surgery. So we've got the puppy, we've got our 4 other dogs. It's kind of a madhouse zoo over here right now. And so she just kind of, got them outside, let them go to the bathroom, and then had to come back and feed them and take care of all that stuff and do her initial workday stuff. Said she'd be back. So I checked myself into the ER, sit around for a little bit, go back. They ask me some questions, take me in for some x-rays. They draw a bunch of blood. The nurse fucked up on my IV. I don't know if you guys can see
the bruise. Yeah, she missed. Or she blew the vein out.
Yeah, she did something fucked up. Like she stuck the needle in. She's like, okay, big poke, hang on. So she pokes, and then there's a period of nothing happening, and then I could feel her moving around, and then she says, "Oops, well, that's not what I wanted to have happen." And then she said, "Yeah, well, I broke it." Oh yeah. Well, I'm guessing like she put it in my arm and then was poking around to see if she could find the vein, and apparently couldn't. And so she withdrew the needle and then put it into my forearm and found a vein easily that way. Anyway, they drew a bunch of blood, ran a bunch of tests, had me wait, hooked me up to all kinds of shit. Came back, drew more blood, ran more tests. Came back and said that, everything looks okay. Like it doesn't look like I've had a heart attack. But that there's a risk, that with a reading of AFib and the whole time I'm hooked up to heart monitor shit while I'm in the hospital, everything was fine. My resting heart rate got really, really low. Like the alarm kept going off because it got down to like 40. And apparently I have a fairly low resting heart rate, and it's just getting lower since I've started walking and all that kind of shit. But, apparently that's like a really, really great resting heart rate. That's like athlete level resting heart rate.
I mean, if you go too low, you're dead.
Yeah, that's another great point. Yeah. But yeah, it kept going off because my heart rate would dip down. It would start the alarm anytime it dipped down below 45, I believe. And it kept doing that. Like I'd start to drift off a little bit while, cause I'm just sitting there while they're running tests, and it would beep and wake me up. And Tracy was back in there. We asked the nurse about it, and she's like, "Oh yeah, well, your heart rate just keeps dropping really low." My blood pressure was okay. My heart rate is good. I've got a healthy heart rate as far as that goes. They ran tests in between to see if there was a particular enzyme, starts with a T, I can't remember what it is, to see if that had increased, which would indicate heart damage, and that was fine. So they ended up ultimately discharging me and telling me that I need to come back for a stress test. And this opening is already way too long, so I'm just going to stop there and say that everything is okay. I'll be going in to see my regular doctor tomorrow. Maybe we'll talk about it more on the other side of this little break, but in the meantime, I feel okay. Everything's okay. I'm going to go see my regular doctor tomorrow, and we'll know more after that.
This is Matt Dillahunty, and you're listening to The Godless Revolution.
Wait, the world isn't that bad, though, is it?
Oh, it's pretty bleak. If you ever met the dick responsible for this world, you'd agree.
Are we talking about God? You've met God? And he's a dick?
His name's Antoine, and yes, he's an absolute troll.
Thank you to everybody who has rated the show on iTunes and Stitcher and are following us on YouTube, Twitter, and Facebook. And to all our Patreon patrons, you make the show possible.
Oh, welcome back, everybody. So I feel bad. I've just kind of hijacked the whole show. We had a show prepared that we were going to do, and I feel like I've just kind of hijacked the whole thing with this news that I didn't even tell you guys about until we started recording.
I mean, as we just said offline,
Rachel Maddow us.
Yeah, the douchebag who we were going to talk about will still be around next week.
Oh yeah,
running for a political office.
Yeah, for sure. Yeah. But I'm sorry. We talked about a bunch of stuff before we started recording, and then I feel like I just have kind of hijacked the topic for this evening. But there's a lot more.
It's an important topic.
Yeah, and there's a lot more to this that is fucky and highlights a lot of the problems that we have with the way healthcare is handled here in the United States. It's not even really healthcare. It's more like, I don't even know what you would call it. It's health
products and services.
Yeah, basically.
It's can you afford to live?
Yeah. How much do you value your life? Because your insurance company, and medical providers
nice
don't.
Body you have there. Shame if something were to happen to it.
Yeah. Yeah, basically. So going back to what happened, like when Tracy first dropped me off, I walk into the emergency room and of course there are signs emblazoned on the door and signs standing in the doorway. And then just inside the emergency room that tell you that, everybody needs to be wearing a mask, and they've got plexiglass surrounding the desk inside the ER. And all of the nurses, of course, are masked, and everybody in the waiting room is masked. There's some fucking shithead lady in there wearing a Let's Go Brandon shirt and has her mask, of course, below her nose, because why wouldn't she? She's already demonstrated that she's a terrible human being. So, they get me checked in, and, I obviously didn't have any broken limbs. I wasn't crying and in dire pain. I wasn't bleeding anywhere. And so they had me, just asked me a couple questions and then had me go and take a seat on the other side of the desk, before they came over and took my vitals, got my temperature, blood pressure, asked me a few different questions about how I was feeling, why I was there, who my insurance provider is. You've got to go through all of that information with them.
Huh. Wow. Yeah. Triaging. Can you pay for this? Oh, you can't pay for it? You're in the bottom of the triage cycle right now then.
Yeah. Yeah. Well, if you could just slide over to the side and we'll get to you as soon as we can. Yeah. But I do have great medical insurance. As far as the American healthcare system goes, I have good healthcare coverage. I'm a federal employee, so I get a good plan at a decent rate that I still pay between myself and my employer tens of thousands of dollars every year for coverage that largely goes unused. And when it is used, it's overcharged for everything. And then you have to go through a bunch of hassle. But I
had to pay hundreds of dollars this week for an MRI. Yeah, I feel you.
Mm-hmm. Yeah, it's ridiculous.
And that's with having the best health plan available to me through my company.
Yeah, it's fucking stupid the way we do our healthcare here. So they get me checked in, ask me all the questions, have me go and sit in another room. The doctor comes in, asks me questions. They do my blood pressure again. Then they hook me up. They put I'm guessing it's a disposable or one-time use blood pressure cuff. It was kind of neat, but they put all of the sticky shit sensors all over me and hooked me up to a bunch of wires and machines.
The 12 lead to check all the angles on your heart to see exactly what's doing what.
Yeah, it was weird. They put I don't know, probably half a dozen, not half a dozen, a full dozen different sticky things all over my torso, and only ever used 3 of them. I don't know. I don't know why they hooked up all of the other ones. But they do all of that, hook me up to all the machines, run the test. I go in for the x-rays. I get, x-ray from the back. Well, I don't know. They had me put my chest on the plate and grab a bar up above. And then they did one from the side where I'm grabbing bars up above. Do all of that.
X-ray, it kind of goes all the way through.
Yeah. Well, but I just wasn't sure if the x-ray was coming from the front, like aimed at my chest or at my back, through my back to my chest.
I think it was going through your back.
Yeah, probably. But apparently that all checked out. My nurse apparently was very upset with some of the x-ray techs. Like after she fucked up the IV, one of the x-ray techs came in and they're like, oh yeah, we just need to take him in for x-rays. And she's like, well, I'm not done yet. I'm still hooking up his IV right now. You can come back later. Like, she was just really fucking rude to her. And the x-ray tech was just like, oh, okay, well, yeah, I'll come back. Sorry. And she just backs out of the doorway and closes the door. And the nurse is like, and that's why you're supposed to call. Instead of just showing up in the room. Like, she was
Someone was having a good day.
She was really pissed off about it. So, they're having their little battles. So she leaves. They take me in for the x-rays. I come back from the x-rays. The x-ray tech didn't hook up my blood pressure cuff, and I think he hooked up one of the leads wrong or something. When the nurse came back in, the blood pressure monitor thing, I could hear it like it wasn't doing it the whole time, right? It would do different readings at different times. I don't know how often it was doing it. But he didn't hook up the hose back to the cuff. And so she came in and the machine was just like, it had stopped making noise. And it was just beeping because it had tried taking my blood pressure and of course wasn't able to. And I don't know what the fuck is supposed to be going on. I'm just there. So she comes back in and she's like, well, what's going on? And I'm like, oh, I don't know. This thing is beeping. And she says, oh yeah, well, it's not reading your blood pressure. I'm like, oh yeah, well, he didn't hook the thing back up. She's like, yeah, I'm unhappy with our x-ray techs today. And I'm thinking, yeah, I noticed that earlier because you were not very nice to him. So all of that happens. The doctor comes in, tells me what's going on, said that they had taken my blood and ran some tests. And I can't remember the enzyme that they look for. It starts with a T. That she said they do their initial testing and then they wait for at least an hour and then they'll come back in and draw more blood and run that for testing. And then that will let them know if there's been an increase in this enzyme that is indicative of a heart attack, that, your heart would be, or your body would be, show increasing levels of whatever this particular enzyme was. And so after waiting there, I think we got there at like 11 and finally about 4:30. And so while I'm sitting there, I'm looking at my phone and you, Taylor, tried calling while I was sitting there. And I'm like, well, I don't know if I should answer because I don't know when the doctor is going to come back. And then I'm going to have to explain I'm in the ER and that's going to be bad. It's just like, I'll just call him later or send him a text later and let him know what's going on. So that's why I didn't take your call on Monday when you called.
No worries. I'm sorry for not sending you a follow-up text, but as will be revealed later on, it was something that I didn't really want to put down. So yeah. Oh no, yeah. Because I was in a similar situation where it was something that I didn't want to have to go through and explain all of what was going on.
So whole deal, it would be better during a phone call where we could just talk and ask questions back and forth. And yeah. So, at the end of all of this, I've been in the ER for like 5.5 hours and Tracy was there most of the time, just being a trooper and asking questions. And that's always good. I would recommend that anytime somebody has to go into the doctor or anywhere for anything to always have somebody else there with you because, sometimes you're scared. Sometimes you're nervous. Sometimes you're in pain. You're not thinking clearly. You're not processing information as well. And it's always good to have another brain, set of eyes, and another mouth there to help keep track of everything that's going on. It's good to have somebody
and
there.
That should ideally be a person who can both be diplomatic but also assertive.
Yes, absolutely. And understand that while you're while you're in somebody's care, you need to be an advocate for yourself.
Yeah.
They are there to hopefully do their best to try to help you. But if you feel like you're not being understood or they're not addressing your concerns, you need to tell them that. And you can be nice about it and just say, look, apparently there's a communications breakdown or whatever, but I just feel like I'm not being heard, or, I have questions about this, and take your time and make sure that they answer any questions that you have, because that's what they're there for. They're there to help you.
And I would also recommend that if you call 911 and fire department or paramedics or an ambulance shows up to your house, be open with everything. Don't hide anything.
Oh, yeah.
Because it sucks when you are telling paramedics or firefighters one thing, and then you get to the hospital and the story fucking changes.
Mm-hmm.
Because the paramedics and the firefighters are the ones relaying information to the hospital before they arrive so the doctors can get ready for you. And if you're not being open about what's going on, you're like, I don't want to tell you. I'll wait for the doctor. Don't worry. Don't be embarrassed.
Yeah. Don't put your life
information you give us is what we're relaying back to the hospital to let them know, hey, this is what's coming. This is what's going on. This is what we see. This is what they're saying.
Yeah. I mean, in order to provide,
and without getting into too much detail, if you're going to put something somewhere, make sure it's got a wide base. Okay. That'll save you an embarrassing trip.
Or a string.
And
well, I watched that show. Me and Sarah have been watching that show Stuck. The first episode. Whoop. Right up there. Stuck.
There's a show called Stuck.
Gone.
Yeah, it's kind of funny. Me and Sarah started watching. There's only like 3 episodes on Hulu. Very first episode, very first thing is a lady that got a vibrator stuck up her ass, like way up into her colon.
Yeah.
Yikes.
Anyway,
Sir Lemon Winks needs a ripcord, you know.
Lemmy Winks. Oh man. So, but yeah, I mean, always, be an advocate for yourself. Make sure that somebody is there with you. And yeah, like Ryan said, be open and honest with your doctor. They can't provide the best care if they don't know everything that's going on. Tracy's mother has had some health concerns recently. And so Tracy has gone to the doctor with her, and, the doctor will come in and ask questions, and Tracy's mother has not been entirely forthcoming or straightforward with all of her answers to the doctor. And Tracy's just like, look, they're not here to judge you. They're here to help you, and they can't provide all of the help that you may need if you're not going to tell them all of the problems and be open and honest with them about everything. They're not your fucking bishop. They're not your mother. Tell the doctor what your fucking problem is so that they can fix it for you.
I'll also say they're not a cop.
Yeah. They're not a cop. They're not going to report shit to the cop unless you're, abusing other
unless
people.
You are harming yourself or someone else.
Yeah.
Or indicating that you're actively going to be doing that. They're not necessarily obligated to report you.
Yeah.
Yeah. Yeah. So just be open and honest with them. They are there to help you. That's their job. That's what they're being paid for. That's what you're there for, is to get help for the fucking problems that you have. Anyway, so always have somebody there with you. Always be open and honest. Always tell them what's going on. The doctor at the end of all of this comes in and says, thankfully you weren't in AFib at any time while you've been here. I understand that you got this reading from your watch, and those things aren't always entirely accurate. They can be off. And I said, oh yeah, I totally understand that. I get that. And I said, honestly, I would not have come in had the triage person, not told me that I should. And then, I don't know, like I didn't, when things like this happen, sometimes you feel like, you may be a bit of a hypochondriac, or you're blowing things out of proportion, but all along the line, all right down the line, I kept saying, it's just a little bit of chest pain. It's not bad. I feel pretty good. I'm not confused. I'm not dizzy. It was yesterday. Still not feeling 100%, but I'm not sure if that just kind of freaked me out. And then I got the reading on my watch, and that freaked me out, and it happened twice. But so when the doctor said, they can be a little bit off, I said, oh yeah, I totally get all of that. I said, but it happened twice, and I've had this feeling before a couple different times, and I've just never had something that I could easily track what was going on, or I didn't have something attached to my wrist that I could instantly go, oh, let's test this out and see if there's something fucky going on. I said, so I get that they can be off. But I'm doing what the medical people told me to do. The people who are professionals told me to come in, and so that's why I'm here. I said, I'm glad that everything is going well now, and I feel pretty good, and I appreciate your time, and I'll be heading home now. Thank you very much. She said that they want me to go in for a stress test. Apparently they'll put me on a treadmill, and while I'm hooked up to a bunch of stuff to check respiration and heartbeat and all of that kind of stuff.
And I think part of it's like rate of rise, almost like how quickly your heart starts getting to a level that they deem, oh shit, yeah, you're at your peak.
Oh yeah.
The longer it takes to get to that peak, the better you are.
Yeah. Yeah.
So.
And in all of this, I kept thinking, well, maybe because I've been a slothful shithead for several years now, a really long time. Like I've kind of let myself go. I used to be Mr. Sporty guy. I was all into the high school sports. I played baseball and basketball and football, not all for my high school team, but growing up, I played baseball and basketball, and I played football in high school, and I was on the diving team in high school. And, I was Mr. Fit and Sporty. I did a ton of weightlifting for a very long time. I've always been a fairly fit guy. And then I got married and had knee surgery and a couple kids. And, I stopped working out nearly as much. Life happened. And yeah, I've put on a lot of weight since the peak of my fitness, and have let myself go and haven't done a lot of exercising for quite some time. And so I thought, well, maybe since I've been getting into shape, and I've been walking and lifting weights and doing all of that kind of shit, that maybe I knocked something loose. I had some shit built up that I've now knocked loose because I'm finally getting back into shape, and my heart's beating rapidly for several minutes at a time lately. And it maybe is just cleaning out the pipes and knocked something loose, and it's flowing through my system, and ultimately it will be okay. It was just one of those things that's going to happen while I'm on the road to getting into better shape. But they want me to go into and have this stress test done. And it's interesting because while I was sitting there, they check me in through the ER, and it's just the kind of cursory thing. They put the bracelet on and lead me into the room in the back. And then I'm sitting there and I get a text message from the ER telling me, to complete my check-in. And it sends me a link where I can go to their website and finish filling out all of my information, double checking my address, phone number, insurance information, all of that kind of shit. And so I do all of that. And, then later I also get another message that they want, somebody tries calling me to set up the stress test. It's whatever department is calling me while I'm still sitting in the ER. And I didn't answer the call. They left a message saying, hey, this is, Katie, and I'm calling to set up your stress test. So give me a call back, and so we can get this taken care of for you.
You're like, I'm getting x-rayed right now, woman.
I'm like, I'm still sitting in the ER room. I don't even know what's going on. Like, the doctor hasn't told me this yet. So, we leave. I get this pamphlet of stuff, like all of my test results, the EKG that they'd done, the radiologist's analysis of my heart from the x-rays that had been taken, the doctor's notes for all the tests that were done, and her recommendation that I go in for a stress test. And, immediately I start getting a bunch of other phone calls. And in talking to Tracy, she says, well, because we went to IMC, the Intermountain Medical Center that's close to our home, they don't, their system doesn't share information with my primary care physician, whose practice is through the University of Utah healthcare system, both of which my insurance allows me to go see, but they don't share information. Their shit isn't linked up to share my patient information back and forth through those two different systems. So
in 2022.
Yeah. And
which also comes into the case, if you had to call 911 and an ambulance was taking you someplace, you don't really get a choice on which hospital you go to.
Yeah. And
they might not have your information.
Yeah. Or they may not accept my insurance, and then I would get a bigger bill, like all of that kind of bullshit. So I start getting messages again and phone calls, hi, this is so-and-so calling again to set up your stress test, and we'd like to get this taken care of as soon as possible. Also, we've got a heart monitor thing that we'd like to, have you come in and get fitted for and send home
for $500 a day.
Yeah. Like all of this kind of shit. And it's like, well, I need to talk to my primary care physician first. So then I go and try to set up an appointment with my regular doctor. And of course, then I have to go through a whole new round of questions and what's going on. And I tried calling and nobody was available to schedule an appointment with me. So then through the MyChart app online, I send a request to have somebody call me back to set up an appointment. So somebody calls me back to set up an appointment, and I have to go through the whole fucking story with them again about what's going on and tell them that the ER discharging person told me, and I've received several phone calls from other people, to schedule a stress test. Well, they can't just schedule a stress test. I need to go see my primary care physician first so that doctor can then order the stress test through the University of Utah health system for me to go in. So now, as it stands, I have an appointment to go see my primary care physician tomorrow at noon, and Tracy will be going with me. And then I'll have to relay all of this information to my primary care physician, who will then have to refer me out.
The same tests.
Yeah, refer me out. Well, yeah, I'm sure she's going to want to run some of the same tests. I've got I've got the thick pamphlet of shit, or the booklet of shit that they gave me when I was discharged yesterday or Monday. And I'll take that into my primary care, and then she's going to have to order a stress test through the University of Utah. I don't know when that's going to be available. Today, while I'm sitting at work, I get another phone call to try to set up a stress test. I answer it, and the person on the phone says, "Oh yeah, we've got a stress test, or we've got this available. We can have you come in tomorrow. We had a cancellation, so you can come in tomorrow. If you don't come in tomorrow, then the soonest we could see you is like April 4th or something like that." And I said, "Well, I said throughout this ordeal, I have discovered some serious flaws in our healthcare system, one of which being my primary care physician doesn't share medical information back and forth with Intermountain Medical Center versus the University of Utah shit. So I need to go and see my primary care physician so that she can then refer me out for a stress test." And the person who calls says, "Well, I'm just letting you know, I feel like I need to advise you that the ER doctor said that you need to get this done as soon as possible, and we have an opening tomorrow and we can get you in, and that if you can't make it in tomorrow, or you don't want to take tomorrow, then it may not be until April." And I'm like, "Well, I just told you that I need to go see my primary care physician first, and I'll have to do what she recommends." "Okay, well, we do have this opening tomorrow, and if you don't come in, then you may not be able to come in for a long time. And, the University of Utah may not have something available anytime soon. So, it's up to you, but I'm just letting you know." And I'm like, "Well,
it's like a high pressure sale."
Yeah. It's like, are you seriously you're doing some high pressure sales on getting me in to take a fucking stress test? Like, come on, man.
FOMO here?
Yeah. Are you doing these stress tests on commission or something? Like, why the fuck are you giving me the hard sale here?
This is New Name Noah, and you're listening to the Godless Revolution.
Ma! Are you serious with the vacuum right now? You really have to do that here? I'm saying my catchphrase. Everybody's watching. God!
You're 22 living in my house. There is no God.
If you have questions, comments, concerns, compliments, corrections, criticisms, or concepts for content, contact the show via email at godlessrevolution@gmail.com, by text or voicemail at 330-81-REBEL, or Twitter the twatter at TGR Podcast. Thank you.
There's one thing I want to point out with your story that I think is a bigger issue with the whole healthcare system. You have healthcare.
Yeah.
You have pretty fucking good healthcare for an American standard.
Mm-hmm.
Yet you still didn't think you needed to go to the hospital at first.
Mm-hmm.
Whether that was like, it's not a really big issue, whatever.
Mm-hmm.
But you can also afford it. And before you go, it's going to cost me something.
Oh, yeah. It's going to cost me a lot. I mean, I still have a $2,500 deductible.
Yeah. Versus someone who might not be able to afford to go to the hospital being like, "Oh shit, there's something really bad going on, but I can't afford to pay for it."
Mm-hmm.
So let's put this off. Let's see if it just gets better on its own because, I can't deal with that bill right now,
mm-hmm.
which is what I think is one of the most fucked up things about our healthcare system is someone will put off something that they might in their head be like, or like maybe block it out. Like, okay, this isn't as bad as it feels. Like I'll get through this. I've been through worse or whatever bullshit they try to do in their brain because they know it's going to cost them a lot of money.
Mm-hmm.
But even if you have the money to afford to, it's like, Yeah. Why do I want to go pay $500 for this when I might have a vacation plan and that money was supposed to be spent on this? So if I do this, it's going to ruin that.
Mm-hmm.
You know, whatever the hell do they use to not want to go to the hospital because they know it's going to cost a lot of money.
Oh yeah. Well, and even setting aside just the cost of it, it's the fucking hassle that you have to go through. Like, not only now do I have to try to figure out how to transfer all of the information that was gleaned from my ER visit to my primary care physician, but then try to get them to input that into their system. And then I have to worry about billing now. Okay, so I went to the emergency room. I know that there's a copay on that. I know that there's a deductible on that. And I know that I'm going to have to pay out of pocket for some of that. How much does my insurance cover as far as my deductible goes? And then is IMC in network or out of network? Like, I know that my insurance will cover some of it, but they're not my primary care. So is that going to be an out of network cost or an in network cost? And then how much is my deductible going to be? And then is it going to be that they're putting all of that on my deductible, or is it going to be that they'll pay 50% and then I'll have to pay 50% until my deductible is met? It's all of this fucking nonsense bullshit that people have to fucking go through anytime they need to go to the doctor. And it's like, well, like if I had a choice, well, I did have a choice, of course, but if I had just said, well, you know, it really just seems like it's going to be too much of a fucking hassle. Like, I feel okay, but like you guys have said, like, all of the signs were that I may have had a heart attack and that could get worse. And people, as Taylor said, people have had symptoms like that and let them go because they didn't think it was any big deal, and then died a few days later because they had a fucking heart attack and their heart muscle was just necrotizing that entire time.
Like, you may have had a heart attack, but you're not having a heart attack now.
Yeah.
While you're there.
Yeah. You're not actively in cardiac arrest.
Yeah.
And so do you want to go through all of that hassle and then all of that potential expense and then just to be told that, oh, you know, yeah, you're okay. It was a thing. We're not entirely sure what it was, but if it happens again, come back.
Yeah. And that's the worst too. And it's got to demoralize so many people when, like, they have something like that happen and then they have to spend so much money to be told, don't know, don't fucking know, good fucking luck. Like, I'm kind of in that situation right now myself because I've had my massive back spasm and I've had my x-ray, which shows that I have, quote, normal degeneration of my disc between my L2 and my L3 for somebody my age. Which, you know, whatever the fuck that means, right?
Means
and
gravity's
that cost me
winning.
money, and I had a really expensive MRI yesterday.
Yeah.
And I strongly suspect that the MRI is going to tell me the same thing that my physical therapist told me, which is that I've got a herniation of my disc between my L2 and L3. And, like, neat, cool. What do I do with that? Like,
yeah, well,
boy, slap me in the ass, send me on my way, tell me not to overdo it.
Well, and then of course, all of this just leads to further delays. Like, you know, the IMC people want me to go in tomorrow to do the stress test. But instead, in the meantime, I've set up an appointment to go see my primary care physician tomorrow, who ultimately is going to recommend that I go and get a fucking stress test. And then how much longer is that going to be delayed? And so it's, you know,
time away from work.
Yeah. So it's more time away from work when I'm super fucking busy and getting buried all of the goddamn time. Like Monday, I missed more than half of a day of work, and that work doesn't go away. It just keeps piling up. And I'm already working 4 to 6 hours of overtime every fucking day trying to catch up, and just not even catch up, just keep my head above water while more shit piles up. My unread email count just goes up every day. Like, I address and respond to literally more than 100 email messages every fucking day, and I still have messages that are going unread and unresponded to because there's just too much fucking work to deal with. And so now I'm going to have to miss, you know, at least a couple hours of work tomorrow, and then I'm going to have to miss more work to go and get this stress test done. And in the meantime, that work is not going anywhere. It's just piling up, and I'm just piling up expense and time, and it's just, there are better ways to do this. There are better systems in place. I don't understand why we've settled for the system that we have now. It's just completely bass-backward, wasteful, and time-consuming and demoralizing for everybody who has to participate in it, from the patient on up through the doctors and nurses and healthcare staff and administrators of hospitals and even the insurance companies and their employees. Like, it's just a massive fucking pain in the ass for everybody involved.
And I wouldn't say
how much better
settled
would it
for
be?
it.
Yeah.
I would say we're forced into it because a lot of people want better.
Mm-hmm.
Yeah. Right. And how much better would the system be if people could like take care of problems before they catastrophize? You know, how much healthier would people be if it was, you know, if they had the time to cook their own food, and if healthy food was more affordable than, you know, grabbing McDonald's on your 15-minute break before you get to your second fucking job. Like, yeah, no, the whole system is definitely fucked hard.
Yeah.
Well, I mean, not even that, just going to the hospital for a minor thing. Like, hey, I think something just feels off. Let's go see the doc.
Right.
Mm-hmm.
Yeah.
And then you catch it early versus catching it as a big problem. Now you got a lot bigger bills to pay and a lot more strain on it. And if you could have caught it earlier, you might have, but you're probably worried, oh, fuck, I don't want to pay for that right now. I can't afford that right now.
Yeah.
I can't afford to live.
Yeah. Yeah. It's like, it would be awesome if we had a healthcare system like the NHS in England, you know, that I could just go in
or
and see a doctor.
Canada has
when I want it. Yeah. Like almost anywhere else has
like
better
every other
healthcare.
Industrialized nation.
Yeah. Has less expensive healthcare with better outcomes. Yeah.
I was in Qatar, right? Which I think is like a third world country, right? And third world doesn't mean people are drinking out of muddy rivers. It technically just means countries that were unaligned during the conflict in the Cold War, right? But Qatar has one major city and one minor city, and that is it in the entire goddamn country. And it is otherwise just a flat sheet of desert. And I would play a game with one of my friends where I would take photos of the ground and I would send them a photo every day. And it was either of Qatar's ground or Mars. And I would ask them which one they thought it was each day. Right.
That sounds like a fun game.
Yeah. So I had an issue where, like, you know how your skin has just microflora and fauna on it, right? Like little bacterias and fungi and all kinds of little things. And they just exist in like a little ecosystem that's largely kept in check. And they're just there on your skin and they occupy you always, right?
There are more cells that are not you than that are you on your body.
Yeah. And there's an issue that can happen if you are under a lot of stress in an area of high heat and high humidity, where that ecosystem can get out of balance. And some of the fungi that live on your skin will cause like basically an autoimmune response. And you get just red blotches. And like, they're not infectious. You can't spread them to other people. They're just really fucking unsightly.
Like a weird histamine reaction.
Yeah, exactly. That goes in kind of like a butterfly pattern on your skin. And so knowing that I had this flare up again, because the last time I'd had it was when I was in Biloxi studying at a cyber warfare school that kicked my ass. And Biloxi, Mississippi is also very hot and very fucking wet. So I went into a Qatari doctor. I explained the problem that I had. I said that I just needed an oral and a topical antifungal for like a week's worth. And that's all I needed. That's all I wanted. And they were like, okay, cool. Well, like, we understand that this is a condition. It's not a controlled substance. So go to the pharmacy. They wrote me a script. I walked 20 feet out of that office to the pharmacy that they had adjacent to the doctor's office. I paid the equivalent of $30 for the doctor's visit. And I paid $3 for the medicine at the pharmacy.
Wow.
And my problem was solved.
Yeah. And here in the US, that would have been hundreds of dollars for the doctor bill.
And and my trip took less than an hour to get all of that done.
It's nuts, man. Our system here is totally fucked. And it's not just the medical system. It's all of the supporting systems surrounding it as well.
The billing, the insurance providers,
because all kinds of middlemen industries have shown up to be lampreys eating the fucking droppings out of the shark's mouth.
Mm-hmm.
Yeah.
Mm-hmm. And we didn't have these industries until post World War II.
Mm-hmm. Yeah. It used to be you go, you see a fucking doctor, you get your fucking medicine, you go home. And now it's an entire infrastructure and industries. And I hear people complain from time to time. They're like, well, what about the jobs? These people, fuck their jobs.
Yeah.
Fuck those jobs in particular.
Uh-huh.
Like if we had socialized healthcare tomorrow and those people lost their jobs, I would not shed a tear.
No, I wouldn't either.
Do you
agree profiting off of misery and death?
Yeah. Do you agree with clubbing baby seals? Well, no. Well, but someone's going to lose their job if you want that job gone.
Uh-huh. Yeah, that's just it. Like they're not like they can try to justify a whole bunch of these positions in their own heads. Like, well, I'm a patient advocate. I work for this insurance company, but I'm there as a patient advocate. I'm the one who helps patients with their billing, with any of their concerns. Okay, but you shouldn't have to do that job. You can do another job.
Yeah.
There are other things available out there.
When Bernie Sanders was running for president, I think it was the first go round, someone had actually written a big thing saying, hey, I am all for, single payer healthcare, and listed all of his reasons. And at the end, it was like, also, if this goes through, I'm going to lose my job, and I'm okay with that because I work for a screwed up industry.
Well, and people make this false choice and have this false dilemma of, okay, well, if we have socialized healthcare, then all of these insurance company jobs are going to go away. Not necessarily. Somebody's still going to have to go through all of the billing. Somebody's still going to have to do a bunch of things that are ancillary to your primary care physician and your visits with them. They're going to have to figure out where all of that money is shuffled around and how it's taken care of, and scheduling appointments and doing all of these other administrative tasks. They're not going to just fucking evaporate if we have socialized healthcare.
But
it's just going to be standardized.
Furthermore, here's the deal. When capitalism causes jobs to go extinct, nobody bats a fucking eye, right? Like there are no more jobs for people who drive horse-drawn carriages, but for a few cottage industries in like New York City, right? That take people around Central Park. That used to be a big fucking deal job.
Oh yeah.
Right. And the automobile was invented, and it was a very limited number of people who said, well, what about the jobs of the people driving horses back then? Because I understood that the technological advancement was more important than holding onto a dead career field. Nobody mourns the loss of scribes living in monasteries, hand copying Bibles. Right.
And I was going to bring your
analogy need to accept that
to a more modern one with Amazon. No one, I mean, we bitch about Amazon. People hate Amazon, but we still use the shit out of Amazon. We aren't like, oh, Amazon has caused a lot of small mom and pop shops to go out of business because Amazon can beat their fucking prices because they can sell that shit for less and basically lose money on it versus what a mom and pop shop can. And why would someone want to pay more? So there's capitalism right there. They won the game there, and they've shut down a lot of Walmart, big box stores shutting down mom and pop stores. You don't care about that, do you?
I've read articles that have said like Americans enjoyed the experience of going to a mall, right? And I get
fun,
that.
Even if you didn't buy anything.
in the Middle East, like going to the mall is a whole fucking thing, right? And I can't speak for any other non-American areas, but it's like a social event. Like, hey, let's go to the mall. Let's wander around. Let's get snacks while we're there. Let's look at clothes. We might buy something. We might not. Like, there's entertainment at the places. Like, I've seen live music performances and that kind of thing in the common area of the mall. Like, it's a whole ass fucking thing. And I've read articles that have said, like, having things like Amazon has taken the experience of going to a mall away from us in America. But the thing is like, then potentially that will evolve again as a market demand, right? Like Americans may say, hey, let's go to the mall, right? Let's spend money at this business that does lots of things, but that has to be driven by upward pressure from the mass populace, right? And again, that's capitalism working as intended. right now, healthcare should not be a capitalized industry.
No, it should not be for profit.
Yeah, right.
Mm-hmm.
That's what I mean. Like nobody should be profiting off of healthcare. The only exception that I can think of is that like there should be something like a profit incentive for a short-term period of time to reward medical research, right? That leads to the development of new devices or drugs or whatnot. But those devices and drugs and et cetera should be very quickly entered into the public domain after the like developer has been given the opportunity to earn, a certain amount of profit that's functionally earned from the government, who would be the primary purchaser.
Mm-hmm. And that brings up a good example, because I've heard people use the argument saying, well, a lot of the medical research is done here in the US, so we got to pay higher costs to cover the cost of doing all that research. And it's like, motherfucker, most of that research was paid for on federal fucking grants that was through our tax dollars. Mm-hmm. So I've already paid for the research.
Yep. Well, and I can see an argument for like, if to steel man the argument, maybe if you knew that you had to fight for grants versus the possibility of increased profits, then you would be less likely to pursue certain procedures over other. But I think it needs to be a mixed environment of seeking profits and also seeking grants, because then like you'll go for the high risk, high reward stuff that might create a miracle cure on the profit side, and the low risk, low reward stuff that otherwise wouldn't be worth researching, but you can just get free money from the government through grants. Mm-hmm. Like in that particular case, I think that there should be both to motivate as broad a spectrum of medical research as possible.
Mm-hmm. I mean, our medical research already has to go through the federal government bureaucracy to say, yes, we deem this as something you can do, whether it's a medication or a procedure.
It's not about the bureaucracy. It's about the motive, right?
No, like but I'm saying like being private right now versus going government isn't going to speed anything up. It's still going to have to go through the same processes to become like a legit thing. But as far as what you're going to say, that you're going with where they'll spend their time and invest their money in their research versus, and I was just wanting to point out that no matter which way it goes, it's still going to take the same amount of time to make it to market. So don't think the government taking over is going to take longer for it to come to market, because there already is the government oversight.
Mm-hmm. And for example, one of the things that Joe Biden did when he was the vice president under President Obama is he was involved in the fight to cure cancer. And one of the things that he helped create is a consortium of medical researchers. And basically what he did is he created the framework for business agreements between multiple medical research organizations and gave them the framework to do a profit sharing environment where these companies could say, okay, we're trying to cure, like, say, rectal cancer, right? And so each of them might go on different research tracks. And some of them might have successful research, and some of them might go down the line of research and say, hey, this didn't yield a result that we can actually make a product off of, right? Normally that would just be sunk cost, right? You invested in research and you found an answer that's no, and there's no way to profit off of no. So what they did is they created a way for, like, if you found an answer that's no, but that leads to like helping them find the answer that's yes, you get to get some of the profit for the company that does find the correct answer because you were involved in the overall effort. And so there's no penalty for like taking a risk and getting a no answer.
Mm-hmm. And you've shown the road not to go down, so someone else doesn't go down that same road.
Yeah, you helped us not waste time following this other track that was ultimately not fruitful. Yeah. Well, thanks for letting me derail the entire show.
Not at all.
At the last minute, guys.
Not at all.
We've run over time, but that's okay. I think this was, I don't know, our healthcare system here is just so super fucked that I think the more attention we can bring to it, the better off everybody will be ultimately, because the way it's going now is just, it's not, the only people that it's helping are fucking rich people. The rich people who benefit off of the misfortune of other people. They profit off of the poor health of other people, and they don't do things to try to improve the system. It's that they do things to try to improve the bottom line and more dollars flowing into their pockets ultimately. Yeah. And if that comes at the expense of other people's health, well, that's just the price of doing business, man.
Yeah. And Republicans are right back at it. I said this, today's the 12th anniversary of the Affordable Care Act. Today when we're recording, and Republicans have already said that that's when they gain power back, they're still going to try to rip that away again with no solution.
Yeah. It's fucking stupid. And I can't understand why so many people still vote for Republicans other than they just want to own the libs. They just want to try to fuck somebody else over. Like they're not ultimately looking to help the most people. They're not out to see the best benefit for the most people available. It's just, I don't like you, and so I'm going to fucking tell you what for, and I'm going to fuck you over. I don't care if it fucks me over too, because I'm too fucking stupid to realize it.
But they're playing Russian roulette while they're playing Own the Lib.
Yeah. Mm-hmm. That will bring us to the end of this episode. Before we go, I want to make sure that we thank our Patreon supporters. That would be...
Two skeptical chaps.
A noble spirit embiggens the smallest man. A perfectly cromulent statement.
Alan Firth.
All hail, Peneth Buttra.
Darwin is coming.
Doug Willoughby.
Hunter Grin.
Is it just me, or are these patrons amazing?
They're so amazing. John McCullough.
Ollie Olson.
Sinead Duffy.
Steve Kuno, who I will get to see in a couple weeks, 3 weeks, nice. I think, at the American Atheists Convention. I hope to see some fans of the show there as well. Yeah.
Time, fast, move.
Wow. Oh, man. Stephen Andrus.
Theodore Sellen.
Tiffany Hudson.
Trisha Weir.
Vanessa.
Corey Ebert.
Don't be a Richard.
Freethinker 215.
Good news, everyone.
Jeff Peterson.
Jeremy Goodson.
Jonathan.
Marvin Draken.
Matthew Sanders.
Megan Mitchell.
Not a fucking gymnast.
The next patron is an updog.
Utah Outcasts is an updog.
Wesley Aaron.
Zeus 9SO.
Janet Uter.
Purple Dragon.
Sarah Segovia.
I'm just wondering what the high-pitched voice was for.
I don't know.
Savita Kuna.
Socialized healthcare saved my life.
Tim Jacobson.
Helen Lovejoy wants you to please support the Survivors Network of those abused by priests, otherwise known as SNAP.
And James, thank you all so very much. This show couldn't happen without you.
We appreciate you all more than you know, for sure. Oh my God, we didn't even announce it. We didn't say we are now an LLC.
Oh yeah.
Woo! Yay.
Holy shit.
We're what you call bona fide.
Yeah. Sort of, kind of. Yeah, it's been really cool. I was very, very excited to see that Morgan Stringer has worked with us, and we have an EIN, and we are an official LLC now.
Holy shit!
So try
we
to
get to call ourselves small business owners.
Yes.
Yeah.
Yeah, I just think that's really cool. We will be working more with Morgan on some other things that will also be for the show, and I'm just really excited about it. I think that's very cool.
That is so cool.
Yeah.
I'm glad that I could be a part of this with you guys.
Yeah, this is awesome. All of you both very much. I'm going to go back to work, back to the grind. Gotta go back to the old grindstone. Yeah. Fun.
Yeah, I gotta put.
I've got a rough few days ahead of me, and I'm gonna go enjoy the quiet before the storm.
All right.
That's all I have to say.
Well, enjoy the rest of your evening, fellows. I shall talk to you later.
Okay.
Arrivederci.
Well, happy birthday yesterday. Did your mom post about that yesterday, or did I see it today?
Oh yeah, she posts about it the day before, the day of, and the day after. She'll say, "Happy day before your birthday, happy day before your birthday, happy birthday, happy day after your birthday."
Oh, that's adorable.
I mean,
I'm just glad you're okay, man. I've been sitting over here having a minor panic attack, like just thinking about all that. Oh my God, dude.
You're listing all the signs and symptoms of having a heart attack or passing a clot.
All right, so I've got the house to myself.
Okay.
Ooh, no pants time.
It's naked time. Is that the reason for the haircut?
Yeah. I want to be taken more seriously. So, yeah.
Does that mean the beard's going to go bye-bye too?
No, fuck no. I look professional now.